2, please join me in a pledge to the allegiance to the flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Doreen, roll call.
Amo, Anagnostakis, Lujan, Sutherland, Tortel, Tui, O'Donnell.
Here.
5 present, 2 absent.
Thank you. So the first item is myself, just a brief discussion on hazard pay. I know there's been some preliminary discussions with the CSEA and the county exec's office. I just want to bring it to the attention of the legislature. So back in the beginning of COVID, we all got these nice pins, right? So I don't know, I think everybody in the legislature got them. No? Oh, well, I knew these pins are like a police thing, so maybe I got it because I was a police. I thought everybody got them, so anyway. It's nice, but it doesn't put any bread on your table, all right? So I'm just going to shorten my comments to Valley View and let PNC talk about the rest of the county as far as hazard pay. But I sat this morning next to the president of St. Luke's Hospital, right, at the Orange County Partnership breakfast, and I just asked her, and it's actually in the CSEA proposal, that all the nurses at St. Luke's got a $2,500 bonus. So I'm not going to talk about any specific amount, but I think that the preliminary conversation from our side anyway should be exactly who are we talking about. I don't think we're talking about anybody that was working from home during this entire period, but we certainly need to have some parameters of what dates we're talking about from beginning to end, and also how many employees. So where's Lawrence? Lawrence in the back, maybe you can just, I don't need it for a while, but I'll call you tomorrow just to see exactly how many employees we're talking about at Valley View. And basically everybody there was ordered into work, if I'm correct. But I'll leave other departments to other committees, all right? But it definitely deserves a conversation. I'm going to bring it up tomorrow at roundtable with the chairman, and we'll go from there. But I think with budget season upon us, and with the amount of reimbursement we're getting from the federal government, and we're in very, very good financial shape, and we owe it to our employees for answering the bell. And actually, I was going to call it Thanksgiving pay, right, to try to get it done by Thanksgiving, but there's an actual definition of hazard pay, which I was unaware of, but thanks to the CSEA. So the Department of Labor defines hazard pay as pay for performing hazardous duty or work involving physical hardship. So certainly that many of our employees fit that bill. So I just wanted to open the door and start the discussion on that, and we'll go from there. Item number 2, Commissioner Miller. There you go.
Good afternoon.
Thank you. So 2A is a request to reclassify 1 fiscal technician, grade 14, to data analyst, mental health, to grade 15, legislative request number 064. Do I have a motion? Legislator Lujan, Legislator Tortel. Thank you, Commissioner.
So this employee requested a desk audit from Human Resources as her job duties evolved over the many years that she has been working with us at the Department of Mental Health, and become much more consistent with the title that Human Resources, after completing their desk audit review with the employee, supervisor, and our department, has determined that this is the appropriate title and grade for the work that this employee is doing, and really appreciate your consideration of this request. It was initially approved, and I believe February, February 27th of 2020. So it's taken a while for this to be brought forward to the legislature, so we really appreciate your consideration.
Thank you. Any questions? Hearing none, I'll call the question. All in favor? Opposed? Carried. 2B is our monthly update. Go ahead, Commissioner.
So I have some very good news. You may have seen a press release that came out from Assemblywoman Gunther's office. She reached out to me about a month ago and asked if we could use any support with mental health police response. We very quickly worked together with our partners, Mental Health Association, Access Supports for Living, Independent Living. They do our crisis call center, mobile response, and peer follow-up and support. And they're currently, as you all know, co-located with our 911 call center, with Brenton Casey being our host, and man the 311 call line. We came up with a plan to target Assemblywoman Gunther's areas of coverage and expand it over to Port Jervis. So this expansion will cover Wallkill, town of Wallkill, Middletown, town of Mount Hope, and Port Jervis. She has awarded us, as we submitted to her, $1 million, which will give us $500 each year for 2 years to expand the teams that will respond specifically in those areas. In some sense, it'll free the response up that we had previously for other areas of the county, therefore equalizing across the county. And in other ways, it will really serve as a pilot so that we can show the impact of a more immediate co-response. Although we've been co-responding, our mobile response team, and responding to their calls for assistance for 3 decades and have expanded, as you know, in recent years, this will help us to be more available. There's many times law enforcement goes out on a call that involves somebody in crisis with a mental health condition and or substance use condition who is, we are not able to respond before they clear the scene. So we'll be able to respond together, and we look forward to positive outcomes. Today, I was just at a mental health, perfect timing, because today was a mental health police response where we brought an expert in working with the Police Academy and the Department of Mental Health to really help us talk through additional ways that we can be even stronger collaborators and co-responding for people with mental illness. So it was perfect timing. Nice to see the chiefs 2 days in a row, but we're really doing some great work here in Orange County, and I'm proud of the work of our partners. September is Suicide Awareness Month. There was a suicide awareness walk that occurred on Sunday, the Out of the Darkness walk. Again, we're putting out the messaging, working with faith-based communities, really wanting to give education and awareness to our community. You don't have to be alone. You can reach out, call 311, call the Department of Mental Health, reach out to a friend, reach out to a teacher. I'm sure that as our students have returned to school, we know the challenges that some young people are having. At the meeting I had yesterday, a parent came up to me and said, my 12-year-old is back in school, but she's struggling, she was crying, she didn't want to return. She's feeling out of place, she's very anxious and emotional. That's one of so many who were remote during the COVID experience that returning has caused them hardships. So working together with our school districts, we want to be sure that they're availing themselves of the services and supports we have in the community. September is also National Recovery Awareness Month, and I just wanted to let you all know, and I can send this to you electronically as well. There is a picnic, Acknowledging Recovery. We talk so much about addiction, we talk so much about fatalities, we have the overdose awareness events, but the celebrating recovery is important too, because that's a hopeful message that goes out that says if you reach out for help, you can get well, and there's many people who join that recovery path with you. So on October 1st at Thomas Bull Memorial Park, there will be a celebration of recovery co-sponsored by ADAC and Independent Living here in our county. So we're excited to be able to announce that event. And I just ask you to continue to support, the social media marketing messaging that we put out. If you ever need additional messaging, please reach out. We'll send you again the information. You can go to the Orange County Government website, Department of Mental Health, and see the new suicide awareness webpage that was created. It's really very comprehensive. We're promoting it across the community. I'm really trying to have our thumb on the pulse of what the needs of the community are. So that's it for me.
Tui. Yes, thank you, Chairman. Commissioner,
Yeah.
did you say you were going to send that out to us so we know where it is? So if we have a chance, we can come by?
Yes,
first?
absolutely.
You
Yes,
can send that to us?
yes, I will.
Okay, I just had one more quick question for you. It's regarding the satellite. You mentioned the schools, and it's very quick. Is it still
It's close.
legal, hands of legal?
It's very close. We're very, very close to coming. So Legislator Tui is talking about a satellite clinic in the Monroe-Woodbury School District, and I believe that the memorandum of agreement has been in the hands of attorneys for 2 years now. So for 2 full years, as much passion as there is behind wanting to have this collaborative response and have the satellite in that school district, trying to get our attorneys and who are protecting us, their attorneys who are protecting them, to agree. Really simply, it has to do with using their Wi-Fi is the last thing we're trying to work out.
Great. And also, there were other schools that have already,
Yes.
Chester and Middletown?
Yes, well, we have Middletown, we have Pine Bush, we have Warwick, which was our very first school district. Yes, Chester is interested, Goshen is interested, so we're working on all of them that are, and Newburgh also has satellite clinics.
That's great. And I know when you started this program, we had so many other issues going on in the news at schools around the country. And that kind of moved it. And now, as we're ever moving so faster and faster with a global pandemic, now it's needed now more above and beyond. So I'm really, really happy and I appreciate all your hard work on getting that done because when things get hung up in legal, that could take a long.
We're still available to the extent we can be to provide support and certainly to refer and connect young people to service. I think I brought up in the last meeting here that we're struggling with not having enough prescribers for young people. Parents are struggling to get appointments. We have a meeting early next month with some of the well-known pediatricians across our community to really brainstorm with them how they might help us through this crisis and help to prescribe and to support some young people who are already stabilized, to open slots for other young people. We also have an agency that we're very excited has come through and requested from the state a crisis residence for children. So that would give them an opportunity to spend 5 to 30 days in a place where they can be stabilized. That would keep them out of the hospital if they're not ready for that level of care, but will give them a place where they could be stable and stay in their community. So fingers crossed, we have that meeting coming up soon. We'll really be advocating strongly for that service to be supported.
Great job. Thank you, Chairman.
I don't know if I can say yet, because they didn't get approved yet. So just wait until, yeah, right, because they haven't been approved yet, so I don't want to put it out yet, if you don't mind.
Legislator Sutherland?
And so that service, if it's approved, would be available in the county? Holy cow. That's amazing.
So we can all keep our fingers crossed. I'm positive.
Oh, yes, okay.
We're excited.
Oh, God, I had a question. I have no clue what it was. Sorry, Chairman. I will email her if I remember.
Welcome to my world, okay?
We do have crisis, right, the Rose House is
Can you
for
put your
adults.
speaker on, please? Thank you.
Thank you, Mr. Chairman. I was actually asking about the crisis respite that we have, or as the Commissioner mentioned, the Rose Houses that I believe is located in Walden. I just had asked if that was only for adults, or if they also do currently allow teenagers and young adults there. Thank you.
They would do young adults, so it's 18 and over at Rose House. We also have, over in Monroe at Access, we have a couple of beds in one of their community residents, and we have some beds at Honor for psychiatric respite for adults. The only respite opportunity for youth is the Friend's House, where we put some additional funds in to wrap around supports for young people who have mental health issues. But that's a voluntary placement, and it's not a medical model, so.
Any other
I remembered. The meeting that you're going to be having with the pediatricians about more services for children in the community, when is that going to be? And
I'd have to look at my calendar because I didn't schedule it, but we're doing it Zoom to make it easy for them because, pediatricians are overwhelmed too, but they've agreed to commit with us to an hour to have this discussion. It's sometime coming up in October.
Okay.
Go ahead.
Will you, would you mind, once you guys have that meeting, shoot us all an email regarding what the thought process is about rectifying this? Because I know how desperate so many parents are, that we've got nobody to, refer the children out to at school. So,
Remember, call 311, call our office. I mean, we'll turn over every stone to try to get kids connected. But when parents are trying to navigate the system by themselves,
very difficult. Okay, thank you so much.
Sure.
Thank you. Anyone else? All right. Thank you, Commissioner.
Thank you.
Appreciate it.
Have a good afternoon, everyone.
Yeah. Okay, prior to number 3, I just want to congratulate Deputy Commissioner Chris Erickson on his part-time job. As I understand, he does great impersonations. Perfect. All right, Commissioner Gelman. Sure. I didn't see you sneak in here. Our county attorney. Thank you.
So just wanted to address, this is on, right? Mr. Tui, your question about the Monroe Woodbury School. So lawyers have clients. Lawyers don't, on their own, just hold things up. The issue with that particular contract with that school is, I'm sorry, I'm a little out of breath, called mutual indemnification. We want to indemnify, we want them to indemnify us for their bad acts, and they want us to indemnify them for our bad acts. Pretty simple. They don't want to do that. So that's a real issue for us, and we want to indemnify them for our bad acts, and we want them to indemnify us for their bad acts. It's really what it comes down to. We have private mental health records on the computers that are being stored on their school. If somebody breaks in, for example, to those computers, one of their employees or does something illegally, we get sued. Well, I want to be indemnified for that. So with all due respect to my friend Commissioner Miller, it's not that the lawyers have had it for 2 years. Lawyers have clients. That's a legitimate issue. Just a simple example. So people, you were very positive. If you weren't positive, I wouldn't call you my good friend. But that's just, people go, oh, it's in law. I just happen to be aware of this particular issue because I was talking to one of my attorneys about it. And I know you've been concerned about it in the past.
You did resolve it, the indemnification.
No, we haven't, because they have not agreed
Are
to,
we getting closer to it then?
well, we're getting closer on other issues, but that's one big outstanding issue.
Well, that could still go on, and I'll tell you,
It's-
it's a fact of life that sometimes things take longer, and if you can't get to resolution, then it's going to take longer, all right? So
We
if I
ultimately-
offended anybody, I'm sorry.
No, you didn't offend anybody. But my point was, people want to know what happened. Somebody goes, oh, it's in law for 2 years. This is the nitpicky stuff that we deal with here, and it's a relevant issue.
Yep.
So I just thought it'd be worth people understanding. People go, what do you mean it's stuck in law? Well, that's the type of issue we deal
Okay,
with.
my father and my sister are lawyers, so maybe I just overstated it.
That's okay.
Because it's-
You kidding me? Of all the things people have said about me, you're the nicest one here. Mr. Lujan's the nicest one here, but you're second.
Thank you, Langdon. Sorry.
How about me? Come on. He didn't call me good friend, so I don't know. All right, Commissioner Gelman, thank you. Number 3A is a request to approve advanced step hiring for the position of supervising public health nurse, which will enable them to start at a step 5, raising the current starting salary from $36,000. I'm assuming this is misprint, $770? Or is that, per hour, $36.77 per hour to $43.4125 per hour. Legislative request number 098, do I have a motion? Legislator Lujan, Legislator Tortel. Go ahead, Commissioner.
Can you hear me?
Yes.
Good afternoon, everyone. Hi. I will have Deputy Commissioner Chris Erickson introduce those two items.
So the one that's in front of you first, this is basically to bring up just the starting pay scale for somebody who's going to be coming into supervising public health nurse position. Typically, we wouldn't have had to increase this step because people would have been in that step if they had worked for the department already, going from a public health nurse position into a supervising position. But now that we look to hire from the outside, people don't come into that step, that higher step. So this is typically for someone who would be coming from the outside into a higher step. It's not going to make them higher than somebody who's currently working there. It'll just make it a more competitive salary. So it's a way for us to attract people from the outside to come into those positions.
So we're eliminating $36.77
Correct.
moving forward.
Moving forward.
And every new employee coming in at this salary is going to be $43.4125.
Correct.
So how did we get at a quarter cent?
That's how the pay scale works when they're looking at the charts, I guess. That's an HR thing.
Okay, so everybody, I'm assuming, already makes at least that amount.
Absolutely. Yeah.
Right. Okay, anybody else have any other questions? Here, Legislator Lujan?
Just what my colleague Legislator Tortel just mentioned, that both A and B passed unanimously through personnel and compensation, and thank you.
You know, that doesn't make any difference with me, right? All in favor? Passes unanimously here too, so thank you. 3B, request to reclassify the position of supervising public health nurse grade 16 to an epidemiologist grade 15. Legislative request number 155. Do I have a motion? Legislator Tortel, Legislator Lujan. Go ahead, Commissioner.
Thank you, Mr. Chairman. Again, I will have Deputy Commissioner Erickson explain the personnel.
Sure. So on this, one of the positions you just talked about there, we'd actually be abolishing one of the supervising public health nurse positions and making that an epidemiologist position, actually lower grade. There's actually a cost savings in that, but it does reflect the position and the rate, the place that we're going as a department, being less of a nursing division and more of an infectious disease and epidemiology type department.
So we're eliminating the public health nurse.
That's what would happen, yep. It would be
Is anybody in that position? I'm assuming nobody's there,
Nobody's in that.
right? But we do have a person in the new position, right?
We don't currently have an epidemiologist
We will.
in that. We will, once this gets switched over, we'll move someone into that position to an epidemiologist, yes.
Okay. Any questions? Hearing none, I'll call the question. All in favor? Passes unanimously. Our monthly update, thank you.
Thank you, Mr. Chairman. To date, we have had 54,011 cases of COVID-19 with 896 confirmed deaths. We currently have over 60 hospitalizations. Since the August report, the department has reopened its call center to help with the increase in the number of phone calls coming into the department. We have had quite the increase in the volume of total calls. We've had a very busy summer of children's camps, pools, beaches, festivals that are permitted by the department, and that's slowly coming to an end. However, we are transitioning, at least with our nursing division, into school-related vaccinations, and overall vaccinations other than COVID-19 have been at an all-time low, I would say. So those are the mandatory school pediatric immunizations. They do remain low, and we're continuing to work with schools and pediatricians to ensure that we are adhering to those pediatric vaccination and immunization guidelines. The medical examiner's office, the design meetings, proposed schematics, and architectural review continues. It does progress in a positive direction, so we're very hopeful on that front. Our nursing division continues to be busy with activities outside of COVID-19, including STIs. We are seeing a continued increase in sexually transmitted infections throughout the county. As far as the COVID update, the CDC continues to report Orange County as a rate of high transmission. The department is aware that clusters are on the rise again, and there are multiple workplaces with positive employees. We are seeing household transmission. With schools reopening, we're also tracking positive cases in school districts and working with those administrations with isolation and quarantine, and we continue to see a number of sport-related clusters. On August 31st, the department started its wastewater COVID analysis project at 6 different wastewater treatment plants in Orange County. As we are completing baseline data collection, preliminary quantifiable results are confirming the presence of high viral burden of SARS-CoV-2, indicative of active transmission throughout the county. Now, what we are seeing in wastewater as far as the viral burden has a lag of about a week and a half to 2 weeks until we begin to see the correlating positive lab results for residents. The COVID county map has been updated to reflect age distribution charts, and typically I do mention the distribution, and thus far as of September 15th, for a total of 53,412 cases as of September 15th, 13% have been in individuals age range of 0 to 17, so that's 7,071 cases. There have been 46% of that total number, 53,412. 46% has been in the age category of 18 to 44, and that's 24,411 cases. 29% have been in the age group of 45 to 64, and that's 15,661. 7% have been in the 65 to 74, that's 3,560 cases, and 75 and over have attributed for 5% of that 53,412 number total, and that's 2,709 cases. As far as the distribution of deaths, as of September 15th, that number was at 891. For 18 to 44 years old, we have seen 29 residents pass due to COVID-19, and that's 3% of the total deaths before September 15th. 173 residents in the 45 to 64 age category, so that's 173, and that's 19% of the total amount of deaths. For 65 to 74, we have seen 22%, that's 200 deaths, and 75 and over, we have seen 489 deaths, which attribute for 56% as far as the age distribution. We are currently working with our planning department and the New York State Department of Health on a wastewater COVID analysis mapping. That way we will have the map available as far as the viral burden that we are seeing in wastewater as compared to the actual numbers. So it will be quite indicative of the how prevalent testing is throughout the county and where we are seeing the actual viral burden of disease. The state and federal COVID funding is being redistributed. We have received multiple streams of ELC funding to the health department, and that is federal pass-through funding to the state that the state has allocated to the local health departments. And we are reallocating $8.676 million to BOCES toward mandatory testing and other COVID-related grant allowable in-school activities. So those include vaccine hesitancy education, improved ventilation, and other grant allowable activities. Vaccination pods have been conducted recently at the SUNY Orange campuses, so the OC SUNY Orange campuses for students and staff going back to school. We're continuing to hold standing point of distribution vaccination sites throughout the county. 2 of those are at our SUNY OC Middletown and Newburgh campus. Also in Port Jervis, Monroe. We are collaborating with schools and nursing homes and other community organizations on having pods set up throughout the county. It's really a divide and conquer model because the large mass vaccination sites are not really seeing the turnout that we would anticipate. The nursing division continues to vaccinate our homebound population who can register on our website or they contact our office for the aging. And any resident can go to www.orangecounty.gov.com, homebound vaccination to register. Now, in terms of vaccination in general, we have had a number of calls in anticipation of vaccines being approved, at least for emergency use authorization for our younger cohorts, as well as the booster or third doses. In anticipation of that, we are planning quite a few activities as far as county-wide vaccination efforts. We're also trying to work with our providers, pharmacies, pediatricians, so on and so forth. Just to kind of, I know it's been quite cryptic as far as which vaccines have been approved, which vaccines are under emergency use authorization, third doses, boosters. It's quite the plethora of information out there. COVID vaccines that have been currently FDA approved are the Pfizer vaccine, so that's the mRNA vaccine that has currently received FDA approval for individuals 16 years of age and older. So the Pfizer vaccine for 16 years of age and older, first and second dose, has been FDA approved. As far as emergency use authorization, the Pfizer vaccine third dose, and when I mention its third dose for immunocompromised and immunosuppressed populations, now those are very specific dosage. It's intended specifically for conditions outlined on the CDC and the New York State Department of Health website for the immunocompromised and immunosuppressed populations. Those remain under emergency use authorization, as well as boosters that we heard of, and those have been approved and recommended for individuals 65 years of age and older. So third doses for immunocompromised and boosters, which are again the third dose of vaccine, but they're booster shots for individuals that are 65 years of age and older. They remain under emergency use authorization. Now, the Pfizer vaccine for individuals 12 to 15 years of age also remains under emergency use authorization. So that's the first and second dose currently of the Pfizer vaccine. Moderna for individuals 18 years of age and older, both first and second dose, as well as the third dose for immunocompromised and the booster for 65 and older, again, is remaining under emergency use authorization. And the Johnson & Johnson single dose for 18 years of age and older is under emergency use authorization. So I just wanted to kind of give that background to it because there has been quite a bit of confusion as to what is currently going on. Now, there are discussions for Pfizer approval that is pending for the 5 to 11 age categories, but a lot of the safety committees are still meeting as far as the efficacy and safety for those recommendations for that age cohort. As far as current COVID statistics in Orange County, as of today, Orange County has seen, as I mentioned, 54,011 cases of COVID-19 since the beginning of the pandemic last March. This has been an increase of 4,360 cases since the last report on August 12th. The increase from July 12th to August 15th was over twice as large compared to the increase from the weeks prior. Our rolling 10-day average as of 9/15, it remains at 117 cases per day on average, and that has been a roughly a little over 20% increase since our last report, August 12th, which was at 97 cases per day. Our 7-day average percent positivity rate as of September 14th is 5.1%, and that's up from 4.1 on August 11th, and that's the date of the last report. And for the month of August, the median age was 33 years old as compared to 34 years in the month of July. There were about 19 deaths reported in August. There have been 5 deaths reported in September as of 9/15 that we have received the death certificates for. The median age for August deaths has been 62.5 compared to 67 years old in July. And as of today, as I mentioned, we have 896 confirmed COVID-19 deaths from the beginning of the pandemic. We typically receive this question as far as how many individuals have been fully vaccinated out of the individuals that have expired after we started the vaccination campaigns. So the answer to that question is 281 of those 896 deaths have taken place since we started vaccinating in January. And of those 281 deaths, 9 deaths have been fully vaccinated. So that's 9 deaths out of the 281 since we've began our vaccination campaign that have been fully vaccinated and contracted COVID-19. They were all older individuals with multiple comorbidities. And in reviewing a lot of those records, some of those infections were nosocomial and really presented later on throughout other disease progression. So those individuals possibly presented to hospitals for other reasons and have contracted COVID-19 as a co-infection at the facilities. So the data that is currently known as far as vaccination reduces hospitalization 10 times and death 10 times. Excuse me. The disease breakthrough rates are typically over-exaggerated or taken out of context. So disease breakthrough rates in fully vaccinated individuals remain very rare, despite of what we are hearing. For fully vaccinated individuals, meaning 2 weeks from their second dose of mRNA vaccine, which is Pfizer or Moderna, or 2 weeks from their Johnson & Johnson dose of vaccine, in clinical trials of mRNA vaccine with the original strains reported, breakthrough in fully vaccinated individual, and that's prior to Delta, so that's your Alpha and other variants. That was reported in clinical trials at 5% of the total participants in clinical trials, and that was the case statewide and locally for the same metric in fully vaccinated excuse me, individuals. That metric was under 1%. It was actually 0.64% as far as vaccine breakthrough in fully vaccinated individuals prior to the Delta variant. Now, in clinical trials with Delta strains with mRNA vaccine, reported rate for fully vaccinated individuals after the Delta variant in clinical trials was around 12%. We're seeing rates that are substantially lower statewide and locally. They vary and vacillate at about 5 to 6% vaccine breakthrough. So it's very important to emphasize that vaccinated individuals are far less likely to contract and transmit COVID-19. They remain infectious for a much shorter period of time, even if and when they do contract COVID-19, and are substantially less likely to be hospitalized and die. And by that I mean substantially less likely than unvaccinated individuals. So this pandemic continues really to be fueled from what we are seeing as far as transmission, predominantly by unvaccinated individuals who continue to contract and transmit disease, sometimes for the third and fourth time around, thereby giving rise to newly emerging, potentially mutated strains that may eventually become vaccine resistant, and that's really what the emphasis is on the vaccination campaigns as far as population-wide vaccination efforts. I will mention briefly 2 or 3 other points, because I did want to note that as you are aware, the CDC and the New York State Department of Health and the Orange County Department of Health have conducted a rapid community assessment to address vaccine hesitancy in Orange County. That report summary is available online at the orangecounty.gov website. So that report looks like this. It does account for quite a few contributing variables to vaccine hesitancy in our county. And it's quite an interesting report and the findings. A common reason that was cited for not getting vaccinated against COVID-19, especially among the young and healthy quote-unquote population, is that they trust their immune system or some variation of that line. And the same goes for those who have already had the virus and assume they've developed some natural immunity. Though the human immune system is indeed extraordinary, it's not worth gambling with a disease as unpredictable and as serious as COVID-19 for a plethora of reasons, including the ones I have already mentioned. With the Delta variant, we're seeing many more young people develop long-term complications and present to hospitals, but also continue to see the after effects for months and even as long as a year after the fact. The declining the vaccine is more than just the personal decision. As I've mentioned, the population health impact. An infected person can easily transmit the virus to others, including immunocompromised people at higher risk for grave illness and children under 12 who cannot yet access vaccines. More importantly, or most importantly, I should emphasize, what does not kill you mutates and tries again. Propagation in population gives rise to new, more transmissible, and potentially vaccine-resistant variants. So please get vaccinated. I will again mention, yes, natural infection does provide some level of immunity. It yet remains to be actually viably measured, and how long it's there still remains a question. There are a number of issues with that. The first encounter with the disease could go very wrong. With COVID-19, you can end up very ill, you can end up hospitalized, or you can die. And there are other potential complications, as I've mentioned, as far as developing long-haul COVID-19, which is an unpredictable disease from what we are seeing as far as long-term complications. We don't know how it's going to affect different people, especially, as I keep mentioning, long-term. All complications and long-term effects of disease are far worse, and these are exponentially worse than any potential reported complications of the vaccine, and happen at a much higher rate of occurrence from what we are currently seeing as far as myocarditis, pericarditis, vascular, and other issues. Vaccines provide protection without any of the morbidities you can get with the natural COVID-19 protection. And when we are seeing bacterium or viruses that can cause severe illness like COVID-19, we need the protection of a vaccine to prevent hospitalization and deaths. Vaccines are the reasons we no longer see any other diseases that people suffered from in the past, such as smallpox, measles, polio, even chickenpox. For those who have already had COVID-19, and I cannot stress that enough, if you have had COVID-19 in the past, please get vaccinated. The vaccines still lower your risk of contracting and being reinfected. We have evidence showing that if you've been naturally infected with COVID-19 and you are not vaccinated, your risk of getting reinfected with symptomatic disease is about 2.5-fold higher. When you introduce vaccines to someone who's already had COVID-19, the body essentially recognizes the invading stimuli and initiates that immune response early on and sets up antibodies to higher levels so they can stop the virus before it enters your system. As a final note, and I promise this is the final note, the real takeaway message here is we're seeing some breakthrough infections among vaccinated people, and we'll continue to see that, but that is expected and does not at all mean that vaccines are failing. The breakthrough rate remains very low in the fully vaccinated populations, even with the Delta variant and other variants since, such as Lambda, Mu, and other ones that we have seen since the Delta. So please get vaccinated so we have a fighting chance to eradicate disease within the population as a whole. Thank you.
Legislator Lujan.
Thank you, Mr. Chairman. And thank you, Commissioner, for always providing us with such thorough reports and for all your hard work and your department's work. Obviously, we owe you an immense debt. Our county is very proud of everything that you're all doing. I have several questions, and it's troubling, to be honest, because it's across the country we're seeing a lot of concern. You highlighted a lot of it in your report, a lot of hesitancy. I see it in my city. I see it across our county. I see it in the media, and I see it in all our different forms of media that have contradictory messages. Unfortunately, sometimes we prefer to believe people who don't have the decorations that yourself and others have. And we prefer to get our media and our information from places that don't have the credentials or the information that could save their lives. That being said, here in this chamber, we're going to be discussing the possibility of banning potential mandates on vaccines. That conversation is not new. It's a conversation, like I said, that's happening at kitchen tables across our country, across the world. Those discussions are not just about vaccines, though. They're also about masks and people feeling that people are frustrated, and rightfully so, about a very, very long and exhausting period where young individuals have been wearing masks and staying at home, as was mentioned. People who are concerned that having their children in schools with masks would only further negatively impact their health. And now going back to the concept of what I started with about the vaccines. I'm concerned deeply, as I'm sure many in this chamber are, about discussions about not getting vaccinated. I understand fully and I respect fully those concerns. I feel that deeply it is understandable that someone might feel those things. I've heard conversations, particularly early on, about individuals who were pregnant who weren't sure if they wanted to get vaccinated. I think in this chamber and in others, we have addressed those concerns. But one, if you could maybe highlight on some of those concerns that people still have, those hesitancies, number one. And number two, and perhaps more importantly to my point, as we will be discussing this potential or this resolution that will be going against mandating vaccines. As a professional, as someone that we look towards for guidance, do you feel that this could negatively impact our mission, our mutual desire, our desire to make sure that we protect the residents of Orange County and our neighbors along our great state?
Thank you very much for that question. As far as vaccination, clearly the case for vaccinating and really the perspective of vaccination, not as an individual prospect that you're discussing with your treating provider, but more importantly from our public health perspective in terms of populations as a whole. There really needs to be buy-in from that population. And overall, our vaccination rate in Orange County currently, as it stands, as reported by the CDC, for our total population is at 55%. So when we have a population, especially with a disease that is currently propagating at much higher rates due to the Delta variant, so if originally the transmissibility factor for prior strains that we have known has been 2 to 3, so for any individual who has contracted COVID-19 in the past, they would infect 2 to 3 other individuals. Currently, that transmissibility factor with Delta is anywhere from 6 to 8. So we've doubled the transmissibility as well as the potentially viral burden also. So it really is a perspective, and I think I can offer definitely a lot of background information as far as the science involved in population health and what that context looks like in terms of herd immunity and the potential that vaccination, mass vaccination, has in us reaching that herd immunity threshold that is a protective population health-wide measure. So I think the real discussion at hand is, and obviously I can't comment on the legislative or legal impact because any mandate or any legal decision really resides solely, unfortunately, heavy is the head that wears the crown, but it really has to do with buy-in from the population and really education, broader education efforts as far as actual viable, confirmed, reliable information that we constantly and consistently provide at the health department. We make information available via our app, via our website, via many different channels and resources. We utilize a social media platform to spread not misinformation, but actual, accurate, viable information. Now, with that said, I can't comment on the mandate aspect of it because, again, the buy-in has to be there. And at the end of the day, the individual making the choice to be vaccinated hopefully is considering the impact of their decision on the population as a whole and the potential of propagation of disease that we discussed earlier on. And the fact that if we do not reach that 80% threshold or more of a total population, and that's any given population, whether we're discussing countywide efforts, statewide effort, nationwide, or global efforts, if we do not reach that 80% threshold, the reality is that the disease will continue to propagate. And when you're discussing it, again, relative context is extremely important when we're discussing population-wide measures, and I can only comment on population-wide measures. When we're discussing settings, especially vulnerable settings, and as we've seen mandates from the state, from the federal departments on, again, different settings, the way they're defining a lot of the settings, they're not just congregate in nature. They really consider the risk-benefit analysis of propagation of disease in those settings and how crippling they are to the population that we're discussing, whether they're susceptible, vulnerable, medically fragile, or to potentially operations, whether that's fiscal, economic, and other burdens and impacts. So I think it's a much larger discussion. I can definitely, I'm very glad to provide the scientific and the clinical and population health impact, and also the perspective. As far as population health, clearly we need to reach 80% or more of a total population of any age, any resident, whether they're residing in Orange County or abroad or in New York State or anywhere else. if we have a chance of eradicating disease. Now, the reality is, if we do not reach that threshold, if we do not reach that herd immunity capacity and stop the disease from propagating, we will continue to see resurgence of disease. We will continue to see clusters and emergence of new variants. And that has, again, a broader impact that I keep bringing up with we don't know what the new strains and variants will look like, and those random mutations that take place when each individual becomes a virus manufacturing facility, each time it gives rise to new variants that may at some point potentially be vaccine resistant. And that's something for some reason that we can't seem to amplify and get across when we are having discussions as far as population-wide vaccination efforts. So again, the relative context is individual choice to vaccinate that you're discussing with your provider versus what we're trying to achieve as far as population-wide herd immunity thresholds.
More directly to my question, do you feel that a mandate or versus a non-mandate would amplify or make things easier for your department?
So again, very difficult question to answer. Only
Being very
because
intentional about asking it that
no,
way.
of course, and only because, and I'm not trying to evade the question because it goes, I think, above and beyond my feelings or my personal perspective on the subject. As far as buy-in, I think that buy-in is very important because at the end of the day, every individual still will have a choice. So if we are mandating this, let's say, as we're seeing in healthcare settings or other vulnerable, susceptible settings where we've seen individuals die in mass. I mean, we've seen mass amount of individuals die due to transmission of disease because they're susceptible, they're vulnerable, they're medically fragile. That individual that is employed there, and we are seeing an uptick in vaccination because of the current mandates. We've seen a substantial increase in vaccinations. But even that individual is making the choice between continuing to be employed there or declining vaccination and terminating their employment there. I think that comes with its own set of issues and there's a palpable impact of both. So I'm really hoping for a wider education campaign and really amplifying the information on the need to vaccinate. So there's a broader understanding as to why we take protective measures, whether they're social distancing or masking or vaccination. Because at the end of the day, even if you are to mandate that individual, if they choose to decline regardless of, they may terminate employment, move elsewhere, but they will still remain with the county. So that's a net sum of zero as far as our population health efforts and public health realms. I know that doesn't directly answer the question, but it's quite the impact.
Thank you. And I know that, a lot of the focus has obviously been on the pandemic, but earlier in your report, you had mentioned, as you have in previous reports, about the continued rise in STDs amongst our youth. At our last budget, perhaps it was the budget before that, you had proposed a position that would actually help address some of these concerns and these numbers. Is that something that you're looking to continue to fill that position that would help us address the rising numbers? And are we still the highest in the state?
We've actually moved to third.
Okay, well, that's...
Since I last reported. So we've lost our coveted #1 position.
Okay.
Not with HIV and syphilis. We're still holding on strong there, but at least with congenital syphilis and other indicators, we're now down to third.
Definitely not something we want to be first in.
Absolutely not.
Definitely not something we want to be third in, but it's better than first.
Yes.
Commissioner, again, thank you for all your hard work, and on behalf of all of us, to your department for everything that they've done. Again, we owe you an immense debt of gratitude.
Thank you very much.
Legislator Tui.
Thank you, Chairman. Commissioner, with regard to COVID survivors, people that had it, and are we doing any tracking as far as residual, long-term, permanent type of damage? I know in my district, there's several people that had it pretty bad. They've got cardiac issues that they didn't have before. They have some breathing issues that they didn't have before, and another one, neurological problems. Are you aware of that in the county? Is how prevalent, and also do we track those, or is it too hard to track because they get referred to other physicians that weren't there?
So currently, and you're definitely hitting the nail on the head, we are seeing a tremendous amount of long-term impact issues, whether they're neurological or obviously respiratory, cardiovascular in nature, so on and so forth. We don't track them per se as far as numbers. We are attempting our best to track reinfection rates, so the newly confirmed cases, whether they're secondary, tertiary. We've had some individuals that have contracted COVID for a fourth time. So we are somewhat tracking, and those are in the hundreds, but we are tracking that through our CommCare system. Unfortunately, what you are mentioning, we can indirectly look into that once it becomes a larger problem under syndromic surveillance, because we do have the syndromic surveillance capabilities, as I've mentioned before, and as we're expanding our biostatistics and epidemiological departments, we can later on retrospectively look at emergency department visits, clinical presentation, and see if they are rooted in initial sort of COVID-19 infection and some of the sequelae. Unfortunately, because individuals, especially in our area, have an abundance of medical providers that they can present to in other counties, in New York City particularly, it's very difficult to track that as an indicator. So we do have some reports, direct reports, or we have anecdotal data at best. And we may have that syndromic capacity, syndromic surveillance capacity available retrospectively, but not right now at this time as far as numbers. Not exact numbers, no. I really wish we did.
But you are aware of it, and I
Yes.
know you hear about it around the country, too.
Yes, as a phenomenon.
So it will be interesting to see.
Yes, absolutely. And there are some preliminary studies, thankfully, being published now as far as cardiovascular, other vascular respiratory impacts for COVID-19, specifically myocarditis as it compares to potential for vaccine-related myocarditis in our younger male populations, as we've heard, which really remains in the single digits, essentially, as compared to the amount vaccinated. Versus myocarditis in the same age cohort. We're now seeing preliminary studies, myocarditis and pericarditis in the same age cohort post-COVID-19, which the numbers are astronomical at this point. So we are seeing some indicators, unfortunately not all, and not to the extent that we would like to see it, but we're seeing some preliminary data. For instance, COVID-19 and vascular issues post-COVID-19, 1 in 6 individuals that have had COVID-19 in the past will develop some sort of clotting or vascular issues down the line. So we are seeing some indicators now as far as data because we have that abundance of data, but not all by any means.
Okay. Thank you.
You're welcome.
Thank you, Chairman.
Anyone else have any questions for Commissioner Gelman?
I just wanted to answer County Legislator Lujan's question about the vaccination legislation. I think it's the most asinine thing I've ever seen. Why does anybody, we're not making anybody take the vaccine here, and why would we take a stance like that? Nobody cares what the Orange County Legislature said. That's something above us. I hate to say that. The governor or the president has made some of these mandates, but why the heck would we even go there? And you know, I went to an economic development breakfast this morning, and I saw like Mayor DeStefano. The first thing we ran into each other said, what in the heck, where the hell did this come from? Where the heck did this come from? I mean, you know, it's just beyond my point. I know Dr. Gelman, you know, she doesn't answer political questions. She answers science and health. But I heard that last night and I said, where the heck did this come from? Try not to curse. So that's my answer to you, Mr. Lujan.
Go ahead.
Thank you, Mr. Chairman. And County Executive, I just want to thank you for coming out and speaking to us to this point, because you and I share the same belief on this. My deepest concern is that it will amplify the hesitancy that we already see, and that's absolutely not what we want. You know, we want to, I think every single one of us in this room, we want to protect our community members. Whether we agree and disagree on certain things, at the end of the day, in common decency, we all want to make sure that our residents do not lose a family member, that we've seen so many losses as it is. And I applaud you for taking that position, because it is the right position, it's the moral position. It is absolutely not what we should be doing in Orange County.
And it's just like, you know, we live this, so Dr. Gelman and I take this personally, but, you know, I had a number of judges next door that have been sick and require emergency hospital care, and they need the county executive and the health department to help get care, just like every other person. And My first question to them is like, we're really sick, we got to be hospitalized. I'm like, all right, did you get the virus? Do you have the antibodies? You've been vaccinated? No, we don't believe in the virus. So why are you calling me? Why are you calling me and why are you calling the health commissioner for help if you don't believe in the virus and you got to go to the hospital because you're sick with the virus? To me, it's very frustrating, and you guys know I usually don't come over and bother you guys, but you asked a good question and you deserve the proper answer. So, thank you.
Thank you.
I'm going to parents-teacher meeting, sorry. Laura, you need me? Okay, I'm sorry.
I also want to thank you for that stance. I was contacted yesterday, and I'm 99.9% there on mandating, but I have that little reservation of it's your right, it's your body. But I do feel that this bill is totally going to harm the psyche of those who may be on the verge, who I'm out there physically talking to them, convincing them, and telling them stories of why I feel they should take that step and get the vaccination. And I've been very successful in talking to these people one-on-one. And I think that this bill, I'll let you all know, I'm going to make a motion that it be withdrawn when we come to our full legislative session, if it passes the Rules Committee. And I feel that it is doing more harm than good in sending out the wrong message.
Well, next week, you guys are going to get my budget, and that's obviously, we have bigger, I hate to say it, but we have bigger fish to fry. And we have these opioid lawsuits as the county attorney has started to work on me with it, how we are going to dissipate those funds. They're very regulated how they're going, but those are the type of priorities we should have, in my opinion. And I'm not trying to say mask or not mask or vaccinate or not vaccinate, but a lot of this stuff we wouldn't be able to enforce this stuff anyway. I'm dealing with the military right now. My guys have to be vaccinated, and gals. If they're not vaccinated by December, that's a mandate with the DOD. They're out of the military. And I got people that are leaving, and I got people that are vaccinated. Valley View, as you know, is a serious concern. Lawrence is still here. But every county around the state is dealing with this. Like, all right, the timeline's coming up. We have a stay in court. What is the outcome? That is something that we have to deal with. But the general legislation I saw that came out yesterday, I was honestly floored about it.
I'm surprised that it's not giving any kind of, the mandate is giving any kind of option, because I have a directive that came out from West Point for their contractors and subcontractors. And what the directive is, you have to sign an attestation form, has to be witnessed, notarized, that you are vaccinated. And if not, there is an option still, which we've been doing all along, is if you are not fully vaccinated, you don't attest to being fully vaccinated, you still have to do social distancing, masking, and every 3 days come up with a negative COVID test. So they're doing that for their contractors, but not for their employees.
I just hate wasting time. That's what it comes down to me. If this body had the power to do this, and I had the power to do this with you guys, and we could talk about it, yeah. I had this conversation a month ago with Dr. Gelman and I and all the school superintendents in the county. They were worrying about mask laws and choice and all this stuff. I'm like, guys, it doesn't matter what you guys say. I hate to say it. And I think, John, you were at a meeting where I said that to a school board. I said, because the governor is the governor of state, she's told us, she's doing an executive order, so why are we wasting time on it? The same thing with this. If this was going to have an impact and you guys wanted to hash it out and decide on it, fine. But to me, it's just a complete waste of time and a bad message to send out.
I agree, so
Thank you, Jimmy.
we're not going to waste any more time on it,
Okay.
okay?
Thank you.
Thank you. Anything else? Thank you, Commissioner.
Thank you very much. Have a good one. Stay well. Thank you.
Item number 4, Commissioner Ledoux, Valley View. Item number 4A is a request supplemental appropriation of funds in the amount of $40,000 for a proposed 2021 capital expenditure to continue with residential unit refurbishments, room finishes, wall covering, handrails, signage, TVs, etc. Appropriated surplus, legislative request number 165. Do I have a motion? Legislator Tortel, Legislator Tui. Thank you. Go ahead, Commissioner.
Thank you. You said it all.
Thank you.
In the description, so we do this annually, so you know. And just a reminder on these capital items, we get reimbursed 75%
No. Thank you.
Just a reminder that we get reimbursed on these items 75 cents on the dollar back in our Medicaid rate in the future. But I said previously exactly what is described, and we do this annually as well.
Thank you. Any questions? Seeing none, all in favor?
Aye.
Opposed? Carried. 4B is a request supplemental appropriation of funds in the amount of $100,000 for a proposed 2021 capital expenditure to support upgrades to information technologies, appropriated surplus. Legislative request number 166. Motion is Legislator Lujan, Legislator Tortel. Go ahead, Commissioner.
This is primarily for computer equipment. I believe there's some TVs in here as well. We do use SigmaCare, which is electronic medical record. The nurses utilize this equipment directly on the units. We do utilize the tablets as well as part of SigmaCare. The webcams are for desks, for people working in offices, so we can have visuals during team meetings, Zoom, so on and so forth, since that is being used more often as well.
Thank you. Any questions? Seeing Majority Leader Benelli.
Hopefully this is on. Oh, it worked, good. Both this resolution and the previous resolution is proposing to use appropriated surplus. Lawrence, I don't know if you have this answer or if somebody from finance is here, but as we are depleting the surplus that's in Valley View, I just wanted to make sure we were on track with this. I think I've asked this question before, and I just wanted to make sure that we were still having enough money that we had planned on as far as from now until the end of the year.
I'll let Donna speak to that if you don't mind.
Hi. Not at all. Thank you, Donna.
Hi. I think we spoke about this in the last meeting. Since 2018, the facility has been using surplus to fund its capital expenditures. We did submit our budget for 2022, and we will be seeking to bond future capital projects so that we can preserve the cash that we have and stretch the debt out over several years. The last time I looked, we had approximately $50 million in our surplus account. Next month is the end of the quarter, so I'd like to give you an analysis showing you exactly where we stand at the end of the third quarter.
Thank you very much. That would be greatly appreciated. Thank you, Mr. Chairman.
You're welcome.
Thank you, Majority Leader. Any other questions? Seeing none, all in favor? Opposed? Carried. 4C, monthly financials.
Good afternoon, everyone. The results we're reviewing are as of August, reconciled to the general ledger as of 9/16. There's been no change to the IGT funding since the last publication. We have $1.5 million. Appropriated surplus is the entry that we'll post at year end, depending on the financial outcomes of the facility. Emergency disaster, this is a small amount of funding that we did receive, $22,200. Lawrence and I did receive information that there may be a fourth round of provider relief funding that Valley View could be eligible for. So we'll continue to pursue that and review the criteria and submit our application. It's unknown how much that will be at this time. Other revenues were coming in at $24,759,000. Normally, there's a $3 million entry that posts in the next month, but it is already posted here in that number. Personal services, we've expensed $14.191 million. Equipment, we've expensed $55,710. On the contractual side, we have $3.2 million earmarked for expenditure, and we've already expensed $5.5 million. On the employee benefit side, we've expensed $11.3 million and a small amount of serial bond debt totaling $94,368.
Legislator Tui.
Donna, with the IGT, I know this comes up all the time. when it looks like we're lagging behind on it. But is there any set pattern of the dates and stuff, or is that just when it comes in?
There is, and the pot of money, we're not really lagging right now, and it's all tied to a specific amount and a pot of money. And that pot of money continues to move each year, and it's also tied in some ways to the upper payment limit, which is established by CMS for Medicare. So we're still on target. It's been approved in the budget, so we fully expect that we will get IGT funding. The amount that we receive is the unknown.
And that could change then from the 7.5 million?
Pardon?
If the number can change, so that can change.
It
from
could
the
change, yes.
It could come
Yeah.
down. Okay. And when do you think that, when do we usually learn that?
We should be getting another payment somewhere around September or October.
Okay, so right now. Thank you.
This is typically the time of year we get a letter regarding the
Yeah.
next payment, so it should be any time now. So hopefully by next month, we'll have more information.
Hey, thanks.
Yep.
You're welcome. Our average census, our performance for the first 8 months of 2021 is 70.71. In August, our census was 80.66. And if you turn to the next page, you'll get a feel for where we stand by payer source. So far through August, 76% or almost 77% of the insurance billings and revenue generated by the facility was due to the Medicaid population we serve. Medicaid HMO was 3.17 and Medicare coming in at 12%.
Okay, can you go back to the previous page for a second, Donna? So August is 80.66,
Yeah.
and year-to-date, it's 75.71. I thought you said 70.
Hang on.
I think you might have just said the wrong number.
Oh, 75.71 is the average performance for 8 months. 80.66 is what was August.
Right, but I think you said 70.
I'm
right?
sorry, I may have.
Okay.
I may
Well,
have.
all right, that's fine. I just thought
It's been a long day.
I thought I was missing something. Okay. I just
Thank
wanted that
you.
correct. All right, thank you very much. All right, do we have any questions on any of the financials? No, thank you. So give us a monthly update, please.
Sure, I sent you this update last week. I do have a few updates to the update, if you will. So Valley View census today was 75.55. We currently have no residents with COVID, which is good. We have, I think we're up to 4 staff members now that are out due to COVID positive or due to COVID contact precautions. 93% of our residents have been vaccinated, and now 84% of our staff have been vaccinated. We continue to regularly offer the vaccine to residents and staff. I didn't put in this report, and I'm sorry that I didn't. The Orange County Department of Health was on site at Valley View last week to conduct a vaccine pod for our staff last Monday, and they were able to get 10 of our staff in to get vaccinated. So that was great, and we really appreciate their help on that. As Dr. Gelman mentioned previously, New York State recently has issued a COVID vaccine mandate for all nursing home staff. Valley View staff must have at least 1 dose of vaccine by September 27th. As of today, Valley View has 80 unvaccinated staff. At the start of the mandate, Valley View had 160 staff unvaccinated. Due to this large number of unvaccinated staff, we closed a unit to consolidate services, and we stopped taking new admissions for a month to ensure we could provide the necessary care to our residents during and after the COVID vaccine mandate. Currently, the Valley View CHA has 15 patients. I put this in my report every month on each patient typically receives 4 rehab visits per week, 2 by physical therapy and 2 by occupational therapy. And these visits occur after initial visit assessment is completed by an RN. Again, we, like many other healthcare facilities, continue to struggle to hire nursing staff, RNs, LPNs, and CNAs. We currently have an electronic billboard ads on Route 17 seeking all nursing positions. We continue to advertise on Indeed, the Orange County website, and on social media.
So what's going to happen on whatever date the mandate goes?
September 28th, just like our employees currently have to have measles, mumps, and rubella, and now COVID vaccine was added onto that as a health requirement to be employed at Valley View. So if you don't meet that requirement, you will no longer have a job.
So what preparations are we making for staffing?
So we will, if we have to, stop taking admissions again. If we have to consolidate another unit, we will do that. I have I'm working on some other avenues for additional staff. I don't want to, I could say it off the record if you'd like. I could talk to you later. I don't want to.
I'll call you tomorrow.
All right, so I'll let you know what that is as well. I have a meeting later this week with the county executive where we're going to, I propose some potential hiring bonuses for nursing staff and referral bonuses for current staff if they refer a new LPN, RN, or CNA. So we're going to review that at the end of this week.
Okay. Any other questions?
I think, if you don't mind, I think a lot of people are waiting to the very last minute. I think they're hoping that the mandate goes away. So I suspect the number will not be 80 by next week. I'm sure it'll be much lower than that. So I'm confident of that. People are, going to be choosing to walk away from their job or not, and I know that's a very difficult decision. And we obviously don't want to lose anyone, but, that's their right to make that decision.
So the health department will be on site for vaccinations, I'm assuming?
That was the only day they were available. They are busy doing other pods. We actually had 20 slots available, and only 10 of our staff took advantage of it. So they'll be back for the second shots in October, and that's the only time we'll be doing on-site pods. There's no issue with access to vaccines out in the community. We've been sharing that information to all of our staff since August, so that should not be an excuse not to get the vaccine.
So how do we share it with the staff? Do we send it out daily or what?
Weekly emails. Anytime we have new information on Orange County pods, we send it out. We send it out through our SigmaCare system. You can send out messages for all the nursing staff that don't have email access. They get a message on the SigmaCare system, and we put it on the email system for everybody that has email access. So pretty much everybody has access to that information.
All right, I'll give you a call on that tomorrow, too.
Sure.
So we should put something up on some type of bulletin board at the entrance exit of where it is being, vaccinations available today. All right, just so we have done everything possible.
Oh, no, I
know we have.
Yeah, yep.
I'm just
Yep,
making sure we go the extra mile.
yep,
Right, so we can't have anything I didn't know or, right.
yep,
All right, I appreciate that.
of course.
Any other questions for Commissioner? Hearing none, thanks for the report.
Thank you.
Appreciate it. Item number 5 is a resolution designating October 2021 as Domestic Violence Awareness Month. Whereas domestic violence is a serious crime that affects victims of all races, religion, ages, education, and income levels, and whereas the crime of domestic violence destroys an individual's privacy, dignity, security, and humanity due to the systemic use of physical, emotional, sexual, psychological, and economic control or abuse, and whereas in 2020, Fearless Hudson Valley Incorporated, formerly known as Safe Homes of Orange County, answered 10,096 hotline calls, sheltered 37 adults and 26 children, provided 4,102 bed nights in its emergency shelter, served 3,325 adult clients and 1,983 children through all agency programs, provided 29,945 advocacy services and 12,280 outreach services. Fearless Advocates provided 13,803 supportive counseling services to individual victims and survivors, creating 5,714 individualized safety plans. Fearless Community Educator provided 83 presentations, reached 1,174 adults, raising awareness about the dynamics and impact of intimate partner violence. 2 youth educators provided 300 age-appropriate workshops, reached 6,083 adolescents and teens, raising awareness on abusive versus healthy relationships, physical and online bullying, systems of oppression, and cultural competency. Displayed the Clothesline Project virtually and continue to raise awareness and acknowledge the deaths of women throughout our county at the hands of their intimate partners. And whereas nearly 4 million American women are victims of abuse each year, and nearly half of women murdered in the United States are killed by their intimate partners, and 4 women per day are murdered by their husband, boyfriend, or ex-boyfriend, and 1 woman every 15 seconds is assaulted by their intimate partner. Furthermore, since September of 2004, 29 women were murdered in Orange County as a result of domestic violence. Their names are Amelia King, Suzanne Timoney, Vicky Godinez, Zhao Hang, Marcelina Gonzalez, Griselda Espinal, Elena Heiberger, Fermina Nunez, Gloria Molina Rivera, Anna Tift, Lulume Stewart Wygant, Florence Benson, Heredia Kajeteri, Deborah Neves, Rami Jasildo, Kathleen Conley, Alexis Harris, Sandra Oliva, Tyra Shell Houghton, Sabine Eichart, Ada Lara, Deanne Mbimbo Leroy, Junko Salters, Marie Giannone, Tanya Smith, Stephanie Vanzetta, Jasmine Emanuel, Amanda Pumillo, Deborah Waldinger, and 2 women, Petra Mohammed and Jessica Lopez, are currently missing. And Moses Molina, who was murdered by her sister's ex-boyfriend at a custody exchange. May they rest in peace. Whereas 1 in 15 children are exposed to intimate partner violence each year, and 90% of these children are eyewitnesses to this violence, and child abuse is 15 times more likely to occur in families where domestic violence is present, and more than 3 million children nationwide are at risk of exposure to parental violence each year. And whereas the National Crime Survey found that domestic violence has a direct bearing on productivity, effectiveness, absenteeism, and employee turnover in the workplace, and it is estimated that 175,000 days per year are missed from paid work due to domestic violence, which costs an estimated $3 billion per year. Whereas this legislature recognized that domestic violence is a major community health issue to our citizenry, and whereas Fearless, Hudson Valley Incorporated, and their Family Justice Center providing one-stop co-located wraparound services for victims of violence and their children, offer hope and assistance for all members of families torn by domestic violence, as well as prevention and education activities in our community. Now therefore be it hereby resolved that the Orange County Legislature hereby recognizes the invaluable work performed by Fearless Hudson Valley Incorporated for the prevention of domestic violence and designates October 2021 as Domestic Violence Awareness Month. I assume that everyone on the committee would like to be a co-sponsor of this resolution. So be it. As a side note, many of you know my best friend and brother-in-law, Billy McDonough, trooper out of Monroe Barracks, was killed in the line of duty December 14, 1975. About maybe 15 minutes prior to his death, the person, Christy DeJordes, killed his girlfriend, right? Same thing, domestic violence, and McDonough was sent to that complaint and was subsequently killed. Thank God for my family and my sister Helen. Responding troopers got into a continuing gunfight with Mr. DeJordes, and he was killed by responding troopers. I was on the Fearless, then known as Safe Homes of Orange County board for a few years. I enjoyed my work there immensely, and they do a great job for us in Orange County. So all of us will be sponsoring that. Still need a motion. So moved by Legislator Tortel, second by Legislator Lujan. All in favor? Aye. All sponsors. Motion for a resolution of Orange County Legislature recognizing October 15, 2021 as White Cane Awareness Day. We have a motion, Legislator Lujan, Legislator Tortel, and I'm assuming everybody, if you want to be sponsored on this also, Doreen. Whereas in 1921, James Biggs, a photographer from Bristol, England, became blind following an accident. He painted his walking stick white to be more visible while navigating the traffic in his community. And whereas to make the American people more fully aware of the meaning of the white cane and of the need for motorists to exercise special care for the blind person who carries it, on October 6, 1964, United States Congress approved a resolution authorizing the President of the United States to annually issue a proclamation designating October 15th as National White Cane Awareness Day. And whereas white cane laws are on the books of every state in the United States and many other countries, providing blind persons a legal status in traffic. The white cane now universally acknowledges that the bearer is blind. New York State Vehicle and Traffic Law provides, quote, every driver of a vehicle approaching an intersection or crosswalk shall yield the right-of-way to a pedestrian crossing or attempting to cross the roadway when such person is accompanied by a guide dog or using a cane which is metallic or white in color or white with a red tip, end quote. And whereas many people who reside in Orange County are blind and or visually impaired, they strive for their own independence and the opportunity to participate in public activities. We recognize their accomplishments and the significance of the white cane and federal and state laws that protect their rights. Therefore, be it hereby resolved that we, the Orange County Legislature, hereby recognize October 15th, 2021 as, quote, White Cane Awareness Day, end quote, and convey these sentiments to every citizen of Orange County so that all might acknowledge the rights of the blind and or visually impaired and abide by the white cane safety laws. Thank you. Like I stated, Doreen, all sponsor. Resolution of the Orange County Legislature designating October 2021 as Breast Cancer Awareness Month. Do I have a motion? Legislator Sutherland, second Legislator Tortel. Whereas, that's why she's here. All in favor of the last resolution on the white cane? Passes unanimously. Thank you. Thank you, Council. Whereas National Breast Cancer Awareness Month was founded in 1985 and was intended to increase global awareness of breast cancer issues, to educate people about methods of prevention and early detection, and to raise money to support research. It has evolved into a collaboration of national public service organizations, professional medical associations, and government agencies working together to promote breast cancer awareness, share information about the disease, and provide greater access to services. And whereas an important part of raising awareness involves the importance of screening and detecting cancer in its early stages so that treatment can occur increasing survival rates and healing, while also decreasing suffering. And whereas the American Cancer Society estimates that during 2021 in the United States, 281,550 new cases of invasive breast cancer will be diagnosed in women. 43,600 women will die from the disease. 2,650 new cases of invasive breast cancer will be diagnosed in men, and 530 men will die from the disease. And whereas researchers, scientists, numerous nonprofit organizations, and breast cancer survivors are dedicated to discovering the cure for breast cancer, during the month of October, we acknowledge the extraordinary commitment and effort invested in this cause and support those who are working towards a cure. And whereas we recognize the breast cancer survivors among us and honor their faith and courage, according to a new report by the American Cancer Society in collaboration with the National Cancer Institute, there are 16.9 million cancer survivors alive in the United States today, and that number will grow to more than 22.1 million by the year 2030, which gives us hope of a better future for those affected by breast cancer. Therefore, be it hereby resolved that the Orange County Legislature designates October 2021 as Breast Cancer Awareness Month for Orange County, and conveys these sentiments to every citizen of Orange County, that all might promote early detection and continued research into the causes and cure of breast cancer. All in favor? Aye. Carried unanimously. Thank you, Doreen. That clears the desk. Do I have a motion to adjourn? Motion, Legislator Tortel, Legislator Tui. Thank you very much. Have a good evening.